Hi there, everyone. My name is Priyak Jutani. I'm a hospitalist at Stanford, and specifically, I am very interested in how to take care of patients in the hospital. And one thing that I have seen in 2026 is that this has been entirely revolutionized by AI. There's a lot of small facets of my workflow that I've changed from when I was an intern to now, and a lot of it in the last 6 to 8 months. So today I'm going to talk a bit about how to utilize at least parts of artificial intelligence as a doctor, medical student, anyone in the hospital. A lot of the stuff I'm going to go over today, I hope provides value, but just remember all of this has to happen in the context of HIPAA compliance and whatever your organization's policies already are about utilizing things like this, especially if you're going to use patient data. So, with that, let's get started. So the big idea that I have, and this is not my idea, but the big idea that I have realized is that AI is not going to replace every single thing in my workflow, but it has been helpful for certain use cases that have actually made my life much easier. And so with that being said, I don't think AI is a replacement for clinicians per se, but an augmentation tool. It is a essentially almost like a right hand man, so to speak, when I'm confused or if I want to make something a little bit easier or more simple. And I'm going to show you some of the ways that I have been using AI to simplify my workflow. The core principle that I want to stick throughout this video is that final medical decisions, what I think is going on with the patient, how I'm going to treat the patient, and ultimately how my differential diagnosis changes, that is still all up to me. I still make every single one of those decisions. And I don't outsource any of that. I don't say, hey, what should I do next to the AI models? However, what I do use is extra information I collect to say, hey, is there a diagnosis that I could be missing here? Or, hey, what could be the diagnosis of eosinophilia in a patient who recently got daptomycin, right? Like these are the things that I can now use AI to get additional information that may not have been readily accessible to me, and I may have had to use a lot of literature searches. I'm going to start with the first aspect, which is AI workflow in medicine, specifically with pre-rounding, and then I'm going to go through the entire day. My day usually starts with pre-rounding. I actually have a video that I'm going to make, and it may actually even be published by the time I make this video, all about how I pre-round effectively. My pre-rounding routine has a lot to do with my iPad and how I utilize Epic on my iPad to actively visualize the patient's lab while I'm in the room, to actively visualize the patient's consult notes while I'm in the room, and to actively create a plan with the patient's bedside nurse while I'm in the room. However, one thing that I did not mention is that Stanford University, which is where I work, actually has something called a chat EHR. We call it Chatter. And what Chatter allows you to do is to physically chat with the patient's chart. So you can literally ask the patient's chart, hey, when did this patient start this medication? Or hey, summarize the patient's last hospital course for me. And it goes into Epic and it actually does that for us. This is actually very public. We have an article about this, which I've linked in this video, linked in this PowerPoint, and this is what it's called. The clinicians at Stanford can actually chat with the EHR. And this is just one of the things that has helped with pre-rounding, and especially when I get handoffs about patients to make myself understand their course better. However, another thing that I can use for Chat EHR is to summarize this patient's hospital course in 3 bullet points. And this is something that is very Stanford specific. But if your institution does not have something like this, I encourage you to think about it because, as I said, a lot of information goes into the medical record and it takes a lot of time to distill it. And believe it or not, I think an LLM can really help you do that. Um, I would never put any of the patient's personal information or any of their HIPAA compliant information onto a LLM like ChatGPT. You have to use something that's more secure with your specific institution. But I give you the example of Chat EHR because that is something that we're using at Stanford. Here's now, let's say after pre-rounds, what am I doing? I am now rounding on patients. What are some use cases of AI that I use while I'm on rounds with patients? I often use it to answer specific questions. So, what is a condition that I should not miss in a patient with hypoxia? And by asking that question, you can actually get 4 or 5 can't mix diagnoses. And it serves as a check for me to make sure I haven't totally forgotten about them. Did I consider PE? Did I consider ACS? Like it is a really good practice to ask those questions all the time. But more importantly, now when I ask those questions, I can get good responses. Because trust me, when you're on your like 16th cup of coffee, it is often tough to remember a lot of those basics that you may not remember all the time. So AI can be that backup for you, that augmentation. You have to be very specific about your prompts. Okay. You can't just be like, what's the differential for hypoxia? But you can say, what are some can't miss diagnoses for a patient who's coming in with acute hypoxia in the last 24 hours after a recent surgery? That allows the LLM to be a very specific answer that you may not get otherwise. Okay, now you're done rounding. How else can you use AI? You can actually leverage AI, at least in my opinion, for diagnostic workup, labs you might want to send out. This is not something we have at Stanford yet, but I do envision at some point AI is going to help us write some of our discharge summaries. They're also going to help draft certain types of order sets, and they might actually even help us with med recs when patients come in and they have a bunch of medications they either are or are not taking. You always, always, always verify AI generated things with your own eyes and make edits as appropriate. Because as I'm going to get to at the end of this video, there are going to be hallucinations that you obviously need to be on the lookout for. Because if you don't look out for them and correct them, you're just adding insult to injury because now you're damaging the source, and now you add more stuff to the EHR that is not accurate, and now that kind of compounds over time. I also want to talk specifically about documentation, and AI can definitely help there. I still will very much caution you against putting any patient data into an LLM. However, if you have a um, institution-specific LLM that has been HIPAA approved, like for example, Stanford actually has a secure GPT that allows us to put in patient information and ask that secure GPT questions. This can be helpful. Doximity also has a HIPAA compliant um, GPT that you can use. With that being said, you don't always have to use it to make patient identified workflows. So, for example, let's say you just have a patient with heart failure. You can say, please provide discharge instructions that would be helpful for a patient who needs to know how to manage heart failure. That is technically a very easy prompt. It's definitely not breaking any sort of patient identifying information. And so you can do that by actually throwing it into these LLMs and having it simplify your documentation. And now, when this patient leaves, you can actually provide them with a very specific type of discharge instruction that can be helpful. So, while AI may not replace doctors, it definitely changes the way you can write notes. For me, it's simplified it quite a bit, but I use the Stanford Secure GPT. You can and should use a secure GPT for whatever it is that you want to do. But if it's patient specific information, you should make sure you have an institutional approval to use certain things. But if it's patient non-specific information, so you just want discharge instructions on how to treat pneumonia for a patient, that's something that you should be able to ask any LLM to do. And that's a very high use case. Um, Here is another way that you can do it. I told you patient communication. Up to date already has this. Up to date has what's known as patient discharge instructions, which are known as basics and beyond the basics, and they allow patients to understand what they were diagnosed with and how they can treat it. However, you can now probably use AI for a lot of this, right? Like you can say, explain heart failure to a patient who at a sixth grade reading level, or make it much simpler to understand. And an LLM can do that and actively change it. So we've talked a bit about like all of the different use cases for AI, but I want to summarize them now. This is known as the S.C.O.R.E framework, and I think it's easy to remember. So the S stands for summarize. The AI can help summarize a lot of dense information in a very small space. So as I told you, we have Chat EHR that can summarize an entire patient's chart pretty effectively. C is to create drafts of patient instructions, maybe a patient note. Again, very specific use cases that should be all HIPAA compliant. O is for organizing information. I'm very confused. I want to organize all of this. Can you organize it into a SOAP format? Subjective, objective assessment plan. R is for refining your thinking. I think this is what's going on. Is there any other diagnosis I'm missing? And E is education. So, as I said, those patient learning instructions. We've gone into a lot of what AI can do, but I want to make sure you know what it can't do. And please be very careful about this. I have yet to ever think about using AI to make final medical decisions. I never use AI for medication dosing. I also never use AI for something in the moment. So if someone is crumping, I act very much on my feet. Um, and the problem with AI is that it's confident even when it's wrong. So I never use it whenever I don't know what's going on. If I know what's going on and I have a good question, then I use AI. If I don't know what's going on, I'm not going to ask the AI because it's going to spew something out at me that I don't know how to make sense of. Here's the pitfalls of AI in medicine that I think we have to be very cognizant of because it will shoot us in the foot if we're not. It hallucinates. It also is something that you might become overly reliant on, which then handicaps you in terms of thinking for yourself. And I think that's very important. You should still be the first pass through everything. So if you're saying this patient's coming in with shortness of breath, I think it's pneumonia. Well, good. You made that decision. Don't ask the AI to make that decision. Once you know it's pneumonia, be like, what's the best way to treat pneumonia? When are steroids indicated in pneumonia? If a patient is not improving on pneumonia treatment, are there certain things I should consider? Like these are all things that you started and you are letting the AI take the next step, but don't let AI make that first step for you. There's also obviously a lot of privacy concerns, as well as this idea that it's going to help us be faster. But does that necessarily make us better clinicians? I'm not sure. So this is kind of all of those things. This is a suggested toolkit that I have based on everything that's been changing. So we obviously have general LLMs like ChatGPT, Claude, Anthropic's product, and these are all things that you can just use to reason through things. Like you can say, how do I think about hypoxia and create a schema? There's EHR integrated tools like Chat EHR that we have that, as I said, allows you to talk to the patient's chart. There's AI powered voice to text that can be helpful. There's note templates that I'm sure will be coming out. And I will recommend that at some point you should create a prompt bank. These are prompts that help you get really good at asking the AI really good questions because half of what the AI returns back to you is based on how you ask it the question that you want it to answer. So here's a very simple, easy way to get started with AI. Try to identify a high use case, develop repeated prompts, and then review and see how it works for you. So I hope this was a helpful video for everyone. If it was, please drop a like, comment, share, subscribe, and I'll see you all in the next one. Thank you so much for watching. Peace.